I think you've got Turing and Valiant, and EpiPen,
Mylan.
and those organizations are really taking advantage of generic drugs which nobody else produced and raised.
And its regulators are part of the problem. Probably the FDA is probably part of the problem because there's no
There's no competitors, and because there wasn't enough financial incentive to be competitors for a drug that had been around for 4 or 5 decades, and which were used a great deal. But this has rolled over into us and huge increases in our expenses. And then if you look across the entire pharmacopoeia, we've seen our costs go up 10% annually. Now that's a little bit more than inflation. And so we are really struggling a great deal with our pharmaceutical costs.
Drug companies say it's the cheapest game in town in trying to treat someone. No hospital stays, no doctor visits. If you can find a miracle drug, it's well worth it.
Yeah, and I agree with that. I don't think there's any question about that. But the question is, what is the profit margin on it?
Right. And okay, so Lipitor, everybody's taking it. Okay. Or a lot of people are taking it. Think about if you didn't have that patent protection, and then a lot of these companies do the marketing for an extended release, or they try to extend it some other way and spend a bunch of money on that.
Exactly.
So what if? Is that the way it should work in the private sector, where shareholders are rewarded by investing in that company, or should the people that are taking it have a break and hold all of our healthcare inflation costs down?
Well, I think you have to have a balance there. I mean, for example,
do we have a balance?
No. I think what we're seeing is, look at what we are paying for the innovation in the pharmaceutical industry here in the United States for the rest of the world.
Right.
And the same for devices. For example, there's a heart valve manufactured in the United States which sells for $3,000 a heart valve. In Japan, it's $10,000, and it's $300 in Egypt.
What?
Now, they're not selling the heart valve in Egypt at a loss. And you see the same thing with others in the pharmaceutical industry, that there is a tremendous premium that we pay in the United States, which is not paid in the rest of the world. Right. So they are obviously going to a market that will absorb that sort of price increase. And, and that rolls over into all of us. That rolls over into you and all of us who are having to do that. We're struggling to try to bring down the cost of health care and make it more affordable and not see insurance rates go up. And I frankly think it is a national priority for us to control this, because it's hard for us to be competitive if we don't have a healthy populace and we don't have affordable health care. And that's going to affect all of us. And this is just one piece of it, is the pharmaceuticals.
Hey CNBC fans, thanks for checking out our YouTube channel. Here you're going to find videos packed with all of the information that you need to be smarter about your finances. You can subscribe by clicking right here, and click on all the videos around me or the eye right here to watch the latest from CNBC. Thanks for watching.